Ladies and gentlemen, my internship experience was very rewarding. It was a very rewarding one because I received very invaluable information that will be of benefit to me so that I may apply it in a practical way to help those who will be in need of such assistance in my community of St. Louis County and City. Learning the proper way to document vital information whenever there are pandemic outbreaks, the manner in which to investigate and numerically analyze the prevalence of an infection outbreak, the use of the scientific method in which to conduct research with verifiable information was also an added asset to my learning, which will be beneficial to the community that I will be employed. The mode of transmission of diseases, such as bloodborne pathogens, and those that travel through the air, such as viruses of the common cold and flu, even the COVID-19 virus is spread in this manner, which is through the air in our environment, and which is now discovered not only to cause respiratory illnesses, but could be prolonged due to its efforts on the human body in the form of long COVID, are some of the information that I've received and of which I've learned to contain and control through the public health education, containment, and prevention. My goal is to work with young people, especially, though not exclusively. It is now known among drug and alcohol abuse. Preteens and teenage children are very highly involved. Enrolled in school from grade 7 to the senior year, some of them, a percentage, are now hooked on drugs and consumes alcoholic beverages. So one of the best ways in helping them is to make them feel comfortable, to give you information and to be able to confide in you as a person of trust and can be trusted. Public health surveillance is one of the key methods of gaining information in the containment of disease outbreaks. The allocation of resources to those who need it after a storm, tornado, or other natural disasters in the community is also key to a very successful public health department or even health institution. In those situations, you will be able to provide them with references to the necessary healthcare professional or in some cases mental health professionals who will be able to help them through whatever crisis they are faced with. Children need to trust you with information, which, if received, in many cases can save lives. Respect of managers with staff is also the key. This internship has contributed to the organization because it helps to create a positive culture of cooperation, respect for all levels of employees, mutual respect between managers and subordinates, and the appreciation of the contribution of all who work as a team. I believe teamwork is vital. A lot of times, some professionals think that they're academically above their fellow employees or co-workers. So, you know, they tend to ignore or appreciate good suggestions and good advice. You know, sometimes good counsel from someone who may be in the field as a public health professional who has first-hand experience to take to those who are on the inside. But, we all have to be able to cooperate and work as a team and not to ignore, in many cases, good suggestions, good documentation from information from the outside. Respect of managers with staff is also the key, or one of the keys in a successful cooperation between departments. This internship has contributed to the organization because it helps to create that culture of cooperation, respect for all levels of employees, mutual respect between managers and subordinate employees, and the appreciation of the contribution of all who work as a team. All contributions should be looked at and respected. All suggestions should be looked at. Important suggestions, that is. My internship experience will contribute to the growth of my professional career as a public health professional because the opportunity it has provided me to explore a large amount of information and contribution of peers who will have to work together cooperatively. New information due to technological advances are also one of the benefits that will help me to spend less time at some tasks because such technology helps to complete such tasks in less time. So much more can be spent with people, advising them and encouraging them about eating healthy, about nutrition, for example, to stop smoking, for example, and to practice eliminating the high occurrence of diseases through proper sanitization and healthy practices. Those are recommendations that I would make to my superiors, to those above me in this organization, is to do a community effort to educate, to inform through social media, the electronic media, television, through leaflets and posters in colleges and schools. This is positive for the company. This is you could say positive for the institution when they see better results in the health of their clients. Health professionals can make a great difference in their communities by just continuously emphasizing on sanitization, mask wearing, good nutrition, alcohol reduction in the diets, and abstaining from smoking and drug abuse. I believe that this preparation will also enhance my academic career and will definitely help me in the completion of my Bachelor of Health Science degree in Public Health, where all these points will be shared in class discussions and also used professionally in the field. Thank you very much, ladies and gentlemen. Thank you for your patience in listening and have a wonderful day. Hello, ladies and gentlemen. A great day to you all, and thank you very much for your attention. After COVID-19 had devastated America, killing over 1 million people, there were measures taken to halt the rules and regulations recently, and advising people that it is now safe to stop wearing their facial mask as an assurance that the COVID-19 pandemic is now under control. But just a few months after the Center for Disease and Control and Prevention has advised schools, colleges, businesses, and other places of assembly to stop wearing facial masks, this was an assurance that things were safe. But now the gone all over again. Ladies and gentlemen, I would like to demonstrate to you the basic steps that I had used of the scientific method. And they are as follows. Making an observation that describes a subject. Inventing my hypothesis. Test or try out the hypothesis and come to my conclusions and make more details of the hypothesis. There are three important methods of science that proves or disproves whether a theory is truthful information or false or inaccurate. It is referred to as the scientific method. This method verifies whether the tenet of a theory is provable from the information and steps that are arrived at, and that the method of investigation to become a theory or not is provable. The scientific method must be workable in order to arrive at a conclusion. The scientific method can boast of a process of verification which is very important. In order to provide material support, the conclusions of an experiment or observations must be provable. So, ladies and gentlemen, we should be able to go back and to refer to such an experiment as to whether or not it's verifiable. And in my case, I can assure you that it is. When a sample is obtained from the population and observed, or studied, or is used as an experiment, such experiment is held in a controlled environment and will be documented to prove or arrive at a theory, if satisfactorily proven by experimentation. A scientific conclusion is also very important since it is arrived at based on the information collected from an observation or experiment. It is therefore very important that all information from an observation or experiment be documented, collected, and stored. The conclusion is the third stage of an experiment and concludes the final step or stage of the scientific method. The wearing of masks is a foolproof test, a test that proves that children are protected by wearing a mask to protect them from COVID-19. Our society and world have been devastated by a virus, and that virus we are still studying extensively. A virus that has destroyed both economies and human lives. There is still very little understanding of how it progresses in the bodies of children compared to adults. But I've conducted a controlled experiment with 240 volunteers of age 16 and under, and have come to the conclusion that the coronavirus that causes the COVID-19 illnesses and death of so many people in America and around the world can be much more controlled by the wearing of proper masks by children. When it comes to the flu or any other easily transmittable disease caused by coughing or by the spreading of it by saliva or cough droplets, the coronavirus that causes COVID-19 is very much in that category of super spreaders. I had in my experiment two different grades of facial mask and required in my experiment from a sample drawn from a population of a kindergarten, elementary, and high school with a total population of 2,400 children between the ages of 17 years of age, and that is between the ages of 5 years old to 17 years of age. The sample is randomly selected from the student population. I did this experiment with the belief that children were super spreaders of the influenza virus, which, though not the same, is quite similar to the one causing COVID-19. The sample of 240, which is 10% of the students, were divided into 4 groups of 60 students of various ages. I had at my disposal facial masks of 2 different qualities. One that is doubly lined with a finely woven cotton insulated material. The other half of the mask were only insulated with a single inner lining protective material. Though these masks were not as perfectly manufactured as those used by medical professionals, such as, in an emergency room, the sample of 240 students were divided into 3 groups of 80 students. Every 80 were the given double line mask. So 80 were given the doubly lined mask rather. Another 80 were given the single lined mask, while the other 80 were not given any mask to wear. This combined group were required to wear their mask for a period of 3 weeks. The group of 80 not given any mask were not allowed to wear the mask for this period at all. At the end of this observation of the students wearing the higher quality double-line mask, only one of them tested positive for COVID-19 and was asymptomatic. He did not show signs of the disease, though being infected with the virus. Of the 80 with the single line mask, 10 of them tested positive with the COVID-19 virus. Of the students without the mask, 35 of them contracted the virus and 20 became ill. This validates the claims of many medical professionals that the wearing of good quality facial masks minimizes the risk of contracting this disease or other, you could say, borne diseases that are spread in a similar manner. It is with this information that I'm requesting, your support to provide 1 million doubly lined masks for St. Louis County residents. The county in which these students reside also. This is the county where these students reside, so that most residents will be able to wear these washable masks and will be protected from being infected by this virus and to assist in controlling its spreading and infection. Promoting hand washing, the storage and preparation of at least 2 million masks, and the same number of 16-ounce bottles of sanitizers are what I recommend to be distributed to the St. Louis community and should be provided by SSMF through government grants and local community fundraising and contributions. Requesting the cooperation and participation of the community so that our health system will be adequately prepared for the next epidemic outbreak. It has been in the public media lately that there has been a rise in COVID-19 cases throughout the country. It is therefore very important that our health system is adequately prepared. Helping the community is indeed helping ourselves. And this can also be done by educating the community through the electronic media, including social networking sites and television advertising and posters and leaflets. You know, we could leave these leaflets in offices, on college notice and schools notice boards. So, I sincerely hope that my recommendations will be looked at seriously, as I'm sure this will prepare our health system and community to prevent any possibility of a pandemic or epidemic as we place the safeguards of a healthy community around us. Thanking you for viewing and have a wonderful day.